Our next speaker is Mr. Thokozani Mkhize. He's going to speak to us on SPECT whole body bone scan time optimization using image quality, a phantom study.
Good morning, everyone. It's quite nice to be able to stand in front of our colleagues. I'll be presenting on SPECT whole body bone scan time optimization using image quality, a phantom study. So basically, I'll be looking at our introduction, the aim, materials, imaging quality parameters that we use, reconstruction parameters. Results is in two parts. The first part is looking at the reconstruction of the standard imaging protocol, then also varying our time. Now, discussion and conclusions will follow then. So now, when we look at our SPECT imaging, we're looking at a technique that allows us to be able to do in vivo measurements of three-dimensional distribution of a gamma photon emitting tracers. Technetium is our most commonly used SPECT imaging with a wide range of applications in SPECT. We know that acquisition parameters must be chosen carefully. These parameters may drastically affect your image quality. So now looking at our SPECT acquisition times, we know that it can range from 15 to 25 minutes per bed position. So these times tend to discourage whole body imaging, often needing 3 to 5 bed positions. So now looking at the prospect of reducing our SPECT acquisition time, we should not be affecting that with our reducing the image quality. So the reduction of the acquisition time can reduce our artifacts, improve patient comfort and also patient throughput. Not adding more patient, just making sure that the patients get more time for you to be able to make the patient comfortable. Images there on the right are showing us the acquisitions and also how the gamma is detected, as per the other speakers who have already said that. So the aim is to investigate the impact of the acquisition time and also to propose a reduction of the time with acceptable effect on the image quality. So looking at our materials, we use our 9.8 liter PET PTW emission photon phantom with 6 fillable spheres. Unfortunately, one of our spheres, the largest one, was damaged, but we could still use it. We've got our activity there of technetium, which was then mixed with 1.5 liters of water to make a hot sphere concentration of about 183 kilobecquerel per mil. We then use 21 mils of that to be able to fill the hot spheres, and then the background was used by the rest. Then we got a concentration of about 22 kilobecquerel per mil. So now your hot sphere to background concentration ratio was 8:1. We use a Siemens Intivo 6 dual camera and MIM software for the analysis. So when you look at our current imaging protocol for the bone scan, you can be able to see that we've got a matrix of about 256, a zoom of 1, acquisition time of 15 seconds per projection, 120 projections, giving us about 15 minutes per bed position. So you know that if we're looking at that for SPECT, it's going to be about an hour of a patient on the bed. So then now looking at our image quality parameters, you can be able to appreciate that we got our contrast recovery, contrast to noise ratio, and also background variability. These affect your image quality that we optimally would get. So now looking at our image quality, you'll appreciate on the right that this is how the contours were acquired on our MIM software. Then looking at our contrast recovery, it is a measure of how well the reconstructed images reflect the true activity. Now we want the higher the contrast recovery, the better the image quality. There, looking at the equation where CH is for the mean counts of your hot spheres and CB will be the mean count of your background spheres. And then R being the ratio of your concentration, hot to the background. Now, if you look at the second one, we're looking at your background variability. Now, this is a measure of your noise level. Now we want the lowest background value for better image quality. And there, the standard deviation for the hot spheres and also for the background spheres. And then lastly, contrast to noise ratio, whereby here we're looking at how well the contrast between the different regions of interest can be distinguished from the noise in the image. And then here we're looking for the higher the signal to noise ratio, the better the image quality. And CH, there's your Hossphere counts, background counts, and also your standard deviation of the mean counts of your ROIs, background ROIs. So the reconstruction parameters, we were using OZEM. So it was 4, 8, and 16 iterations, and we're looking at our Gaussian filter. This is your image smoothing, and also looking at your time projections to see which times could be optimal for us to move to. So now the results of the first part of the project, you can be able to appreciate that now you'll be looking at from your left to your right, you're increasing your iterations, and then the bottom part of your x-axis, you're increasing your filter. So you can be able to see that as you increase your filter, the contrast recovery decreases, and also as you increase your iterations, you expect that now your contrast recovery will increase, but still having the filter going, reducing. So you can be able to see that your contrast recovery slightly improves as iterations increase, but also decreases with the sphere size as noted there. Now we look at also our second image quality, which is our background variability. You can be able to see that as the filter increases, so does what? The background decreases. And we want that for our image because the noise reduces and then your smoothing occurs there. So background variability slightly improves with increased iterations. So now, contrast to noise ratio, and then also looking at the Gaussian filter there. Of course, as we increase our filter, so does our contrast to noise, along with the iterations also, they have that effect. So in terms of this, then our 8 iterations with 8 subsets with a 4mm Gaussian filter was then chosen for the next part of the study now. As these were the 15 seconds studies. So now when we move forward, now you can see that as we vary time, now on your x-axis, it's the acquisition times 5, 8, and 15. And then this will be your signal to noise ratio on your left, middle will be your contrast recovery, further right will be your background variability. And then here, then we can be able to see that as the acquisition times increase with our chosen reconstruction studies, you can be able to see that now our contrast to noise ratio increased, of course, because now counting statistics become more, and also our contrast recovery was stable. Background variability tended to reduce with longer acquisition times. So now, we can be able to see that, as mentioned, the improved contrast recovery, background variability, and also your contrast to noise ratio. So we know that now our Gaussian filter 0 to 4 provides a good balance between contrast and noise, whilst our Gaussian filter of 8 to 12mm provides a poor balance between our contrast and noise. So increasing the acquisition time provides an improvement in image quality we've seen, but the improvement is greater for the 5 to 8 seconds and a slight increase for the 8 to 15 increase. So choosing an acquisition time of about 8 seconds per projection provides a reasonable balance between your contrast to noise and also for these phantom studies. And as always, it needs to be also reproduced for human studies. But then our proposal was then that from our current imaging protocol, we can be able to reduce the time from 15 minutes to 8 minutes per bed position. What that does is, for the same time that we would have spent an hour to image a full body SPECT, you can use half of that time. And then, therefore, that can then be able to encourage us to also do SPECT for our bone scan patients. And then one of the advantages of using our 128 matrix size to the 256 would be that the space is reduced, and also your imaging noise also is reduced by a factor of 2. So this can also improve your contrast to noise ratio and the ability to detect small lesions. However, the small matrix also reduces the spatial resolution. So it is quite important for us to know what we are doing and how we are affecting the images that the physicians are going to see at the end. And these were my references.
Thank you very much. Thank you to our researchers for always trying to get solutions for us.